My name is Susan Spear. I'm a registered dietitian with a master's degree in nutrition, a fellow of the American Dietetic Association, and a fellow of the American Academy of Nutrition and Dietetics. So the question is, what are the dietary concerns of someone with Duchenne's muscular dystrophy? At the time of diagnosis, obesity may already be present, but if it's not, it initially becomes the concern with the lack of physical movement with someone with Duchenne's, and maybe also some of the side effects of the medications that are sometimes used, steroid medications that is used to reduce the muscle destruction, increases appetite. So one of the first things nutrition counseling might focus on is diet to prevent excessive weight gain. And because these are kids that you want to grow optimally as well, you've got to strike a balance between getting adequate nutrition without excessive calories. So one of the things that you would focus on is trying to come up with acceptable substitutes for things that are higher in calories. So if you're dealing with a teenager or an older kid who's insisting on soda, you might use diet soda, or you might super dilute juices so that they're lower in calories, or you might use a plain or light yogurt and fresh fruit as a dessert substitute. As the disease progresses, usually the muscular problems originate in the pelvis, but as the disease progresses, then the child can get problems with breathing, with swallowing, chewing and swallowing. As they start to have problems with chewing and swallowing, then you would use changes in texture modification in order to deal with that. So for example, if you would be having spaghetti and meatballs for dinner with a salad with carrots in it and garlic bread, and somebody that's got chewing and swallowing problems, you would be taking a knife and chopping that up. You might be using a softer lettuce leaf for the salad. You might be taking the carrots out so that there's not a choking hazard there. You might be cutting the crust off the bread. As the chewing and swallowing problems progress, you might be throwing the whole thing in a blender. Then towards the end stage of the illness, as a last resort, the child may be using gastrostomy tube feeding. So putting a feeding tube into the stomach, and at that point you can use blenderized food still if you're strained and you are careful not to clog the tube with it, and or you would use commercial supplements like Ensure, that type of thing that you would be putting in the tube to ensure adequate intake. So from initial diagnosis, where maybe there would be no change in diet, just normal diet for age, through the progression of worry about obesity, all the way to the progression then of worrying about malnutrition and underweight with not eating enough, that's the arc of the dietary concerns for Duchenne's muscular dystrophy.